to expand the mental health workforce for the Oregon State Hospital as well?
We definitely need more professionals at every level of healthcare.
Senator Ron Wyden sharing his thoughts tonight on the need for more mental health resources, including at the Oregon State Hospital. Thanks for staying up with us tonight. I'm Jaewon Jung. Wyden and others in Congress released a discussion draft last month to make mental health more accessible to Americans. He says there's an enormous need across the country. But of course, a hot topic here in Oregon is the current environment at the only state-run psychiatric facility. This is because the facility has been so full that in September, a federal judge ordered the hospital to release patients early. These patients are specifically those who are awaiting trial for criminal charges or aid and assist patients. So instead of receiving treatment for mental illness, these patients are often sent to jail where they wait to receive treatment instead. And those wait times were close to 40 days in July, according to the Oregon Health Authority. Senator Wyden has said there's an enormous need for mental health care. So I asked him if resources at the Oregon State Hospital should be a priority. Here's what he had to say. Do you think that Oregon State Hospital in particular needs to be a priority because of the federal court ruling that happened in September?
That ruling highlights how important it is to upgrade mental health services and services across the board.
So you think it just shows that mental health needs to be a priority all across?
All across the board. It means that we have to strengthen the schools. We have to strengthen the health system, like with telemedicine. We need the wonderful program that Steve and Connie Ballmer are leading that's going to be on behavioral health. And you bet, in terms of professionals, we're going to have to do as much as we can.
And when it comes to mental health, we can't leave out mobile crisis intervention. In Eugene, the CAHOOTS program has really been a pioneer to revolutionizing crisis response. Last year, Wyden says he secured $1 billion to make programs like CAHOOTS national. And last month, Oregon even earned federal approval for Medicaid reimbursement of these types of programs.
The way it will work, and that was the point of the major announcement where we were singled out as first to get going, it's the money, it's Medicaid, federal and state dollars. The money goes to the governor, in effect, the Department of Human Resources, and they're talking with various counties across Oregon that are interested, and I've really been pleased at the response.
All right, so we've talked a lot about securing funding for resources and money being needed for different problems happening throughout the state. But let's be honest, when it comes to money, it's not easy for Americans right now, and that's certainly the case here in Oregon. So will the funding put a dent on taxpayers? One thing I do want to ask, though, is because so many Americans are struggling right now with inflation, is we're able to secure this funding, but does it come out of a taxpayer's expense?
Well, your question is very good, and one of the reasons that I focused on closing tax loopholes, particularly with the very wealthy, and billionaires are able to pay little or nothing for years on end because they can avoid paying taxes. You close those tax gaps where the wealthy are able to avoid paying anything near what working class people pay as a percentage. You have revenue, and then you're in a position to make judgments about some of these key areas that we need to support, like police and mental health officials.